Friends, I am truly delighted to be with all of you. And welcome to all of you to this beautiful city of Hyderabad. Happily, this is a good season to be in this country. Those of you from abroad, you might find the weather not too unkind. I'm not an expert in pharmacopoeia, but I'm a student of biology, trained as a physician, and also I'm a concerned citizen, therefore I have a passing acquaintance and some keen interest in this field, among others. Sometimes when I look back, the past century or so, the remarkable advancement of biology, pharmacology, and medicine, they are breathtaking. A century ago, I do not think that we had any idea of antibiotics. There certainly was no real knowledge of immunization. Jenner just then understood a bit about immunization. Louis Pasteur and others did some work, but there was no understanding of immunization in terms of mass application. There was no aseptic surgery yet of any serious consequence, just about began. The science of childbirth was in its infancy. Blood groups were just then an anvil. Landsteiner's work and other people's work began to make an impact only around that time. And we look back today, that only a century ago we did not have any understanding of any of these things and therefore could not apply them in day-to-day medical practice is unthinkable. Even in the most primitive conditions like in parts of South Asia or Africa or elsewhere, we take these things today for granted. The remarkable work of pioneering scientists, and perhaps equally important, the work of technologists to make it accessible to medical practitioners on a day-to-day basis, and the industry to make it available to people at a reasonable cost. These have made fantastic advances possible in the past century. You are all inheritors of that legacy. History taught us that new technology has opportunities and poses dangers. I'm sure every student of pharmacology is taught the story of thalidomide. That's more or less a classic textbook case of what could go wrong in our quest for modernity. In that sense, understanding the need for and the limits of and the best practice in regulation is of critical significance, we all recognize, because pharmaceuticals are unlike any other products. They have profound consequences. They bring enormous hope and they could cause immense grief. And unless, like all great technologies, they are used with great care and quality, we may end up losing the advantages because a public opinion turns against medications that will not be good for medical science or for mankind. Obviously, all of us are concerned about three things in any technologies or pharmaceutical technologies. First, we want efficacy. Then we want safety. We want it to be cost effective. Efficacy, safety, and cost. It is this trade-off that determines ultimately acceptability of new drugs and formulations and new technologies. And for the companies that propagate research and try and convert it into technology and then make it into a commercially viable product, it's always a clash between hope and fear. Hope that enormous research and years of labor, lots of investment would pay off ultimately. Fear that something ghastly go wrong in a ghastly way, and the companies will simply fold up. Because in modern day, if things do go wrong, the consequences are extremely grievous, not to the human health and safety, but also to the economic health of these companies. One of the areas years, in recent years, which is facing the consequences of the fear, it to me is the transgenic technologies. Only 10 days ago, in a related field, but in agricultural technologies, I had to intervene before the Supreme Court. The Supreme Court of India, the apex court, is almost about to order a 10 moratorium on introduction of technologies into this country, which is unthinkable. But in this day and age, 2012, in a major country like India, the apex court is almost to declare a moratorium on transgenic research. Is something unthinkable. It almost happened. About some 15 days ago or so, I was very upset. I entered the Prime Minister's office and hollered and pushed the Prime Minister to have a cabinet subcommittee constituted instantly and to make the Attorney General go before the Supreme Court and tell them how dangerous that kind of precipitate step would be. And the court is now re-examining the whole issue. This only shows that in days of heightened sensitivities, generated fears, and 24-hour non-stop media, unless we handle new technologies with great care and sensitivity, there's always tremendous danger of either doing too much and therefore risking danger, or doing little and therefore going back to the Stone Age. The path of what is right and how to make things happen is one of the great challenges. Medicine knows that today's human insulin is essentially a product of transgenic technologies. It is safe, effective, it is increasingly affordable to most people. And every student of biology knows the importance of some kind of genetic modification, whether we did it through hybrid in agriculture, or now we do it in transgenic technologies. It does not matter. Essentially, the basic principles are the same. But there is enormous fear generated all over the world, particularly in Europe. What is the continent that actually came up with the most advances in science is now most scared of some of the frontier technologies. And that fear is the rest of the world. I think the scientific, particularly in the pharmaceutical sector, must work very hard to educate the people, to let them know that there is a